Welcome back. Health experts are issuing an urgent warning about a so-called tripledemic, cases of COVID, flu, and RSV all on the rise.
Now, earlier this week, CDC health experts said flu hospitalizations continue to remain at a 10-year high, and RSV infections are peaking in both kids and adults. Joining us now via Zoom is Dr. Allison Bartlett, a pediatric infectious disease specialist at Comer Children's Hospital. Dr. Bartlett, good morning.
Good morning.
All right, these numbers are staggering when you look at it. 78,000 people nationwide hospitalized with the flu since October 1st. How do you react to those stats?
I can't say that I'm particularly surprised. It's earlier than we typically see for influenza, but certainly this is what influenza can do. It is a potentially very serious disease, especially for vulnerable individuals, which is why we've been out pushing the vaccine. We have an effective vaccine that can help decrease this hospitalization rate.
Why are we seeing such an uptick in these respiratory viruses now? Is this an effect of like a post-COVID effect?
I think there's a lot of people working to try to figure that out. Certainly all of the mitigation efforts that we did early on in the COVID pandemic in terms of masking and school closures and social distancing prevented a number of respiratory viruses from spreading. And so now with all of the rollback in those measures to prevent infections, we are seeing rampant spread of a variety of respiratory pathogens.
And you're at Comer Children's Hospital, and one of the things we've talked about a lot is children being hospitalized. What are you seeing at your hospital? How is this impacting you and your colleagues there?
So I today am cautiously optimistic. We've had a very, very rough stretch. In October and November, we saw unprecedented volume of kids coming to our hospital and going to outlying hospitals and needing transferred to children's hospitals for care. And we saw numbers that we've never seen before, mostly due to RSV. The influenza rise hadn't quite started. Fortunately, the RSV circulation seems to be heading down, so we're breathing a little sigh of relief, but now we are definitely seeing influenza affecting children and are bracing for more COVID impact.
Yeah, I know we are hoping for the best. I mean, so many cases that we've seen. So we just talked about earlier in the show, Indiana University Health putting some restrictions in place right now because of this. Only immediate family members are allowed to visit patients. Are you expecting anything like this coming to our area here in Illinois?
So I think many of those are in place already. So, I don't think that most hospitals have gone away from some sort of limitation on visitors. Generally, before COVID, during respiratory viral season, we would limit visitation, at least especially in the children's hospitals, and not allow children to come visit. We haven't allowed children to come visit in the children's hospitals since the pandemic started, so there's nothing to roll back there, but certainly masking and reducing the number of people in the clinical spaces is important in helping prevent transmission.
So, Dr. Bartlett, my family had a bit of a scare this week. A week ago, my 6-year-old was sent home from school coughing, fever well over 100. So you hear all this about RSV, you get worried. Fortunately, taking her to the doctor, there's that triple test where they test for COVID, the flu, and RSV. She did have the flu. We know there's a virus for the flu, a vaccine, I should say, for the flu and COVID, but not for RSV. How can we protect ourselves from RSV, particularly children?
So that's a really good question, and I think there are things that we can individually do in terms of wearing masks when we're out and washing our hands frequently. And there's also things that we collectively need to do to help prevent infections in everybody. And that's where the masking and staying home when you're sick and learning respiratory etiquette, coughing and sneezing into your elbow and not your hands, and throwing away tissues after you use them becomes really important. I can't emphasize enough the staying home when you're sick and getting vaccinated where appropriate. So your child with the flu, right? There's a vaccine to prevent it, and we know the vaccine's not perfect. So even if you have been vaccinated, you can still get the flu, but you tend to be less ill. We also have treatments for influenza, so that's another important distinction to make.
Thank you so much. I know that the hospitals are so busy right now. We appreciate everything that you all do in the healthcare system. Dr. Allison Bartlett with Comer Children's Hospital, thank you for being with us.
Thank you.